Welcome back to Have More Babies. This is where we dive into a stack of sources and really try to give you the quickest path to being well informed on some critical topics. Today, we are taking a deep dive into the role of pediatricians. It's essential, often underestimated, I think. We're definitely moving beyond just the usual idea of checkups and shots. We're looking at these healthcare heroes and the guidance they provide right from the very beginning, those first few days, all the way through the teenage years. It's quite a span. So, our mission here is to pull together insights on the huge range of services they offer, how deeply they get involved with the whole family, and even peek into the future of this field. Okay, let's unpack this. Let's explore the impact these experts have on securing happy, healthy kids.
Absolutely. And I think the key insight really is seeing it as an investment. Optimal pediatric care. It's not just about treating sickness when it happens. It's fundamentally about building the whole foundation for a healthy life. That's significantly cuts down on major health issues and frankly costs later on.
Yeah, the research we looked through, it really suggests that getting that consistent pediatric care early on, it can seriously reduce a child's lifetime health spending. It's just by catching things, correcting issues that might otherwise snowball into chronic problems.
That totally reframes the value, doesn't it? We naturally think doctor when a kid is sick, but our sources, they just kept hammering home the importance of preventative care. That seems to be the real engine here. The power of that regular checkup, it's way more than just ticking vaccine boxes. It's the chance to actually watch a child's development over time, see the patterns emerge, being able to spot and deal with potential health issues before they become a big deal. That's the major advantage, right?
Yeah.
Exactly. And it's not just physical stuff either. One thing that really stood out in the research was how directly a child's physical health impacts their emotional well-being and their cognitive growth, too. Think about it. If a child is constantly fighting allergies or maybe has an untreated hearing problem, well, their ability to learn their emotional state, it's immediately affected, compromised, really.
That makes complete sense. So, okay, prevention is key. But when things do get more complicated, the sources also stress the pediatrician's role in the long haul, particularly managing chronic ailments.
Oh, absolutely. And what's fascinating there is that managing something persistent like, say, pediatric diabetes or severe asthma, or even those rarer genetic conditions, it's inherently tougher in a patient who's still growing.
Yeah.
I mean, you just can't treat a 2-year-old the same way you treat a 10-year-old with the same condition. The physiology changes. And that constant need to adapt, that's why managing chronic care demands really seamless collaboration. The pediatrician often acts as the central hub. They're coordinating with maybe a lung specialist or a pediatric endocrinologist, but crucially, they lean heavily on the family. Full cooperation, full compliance, it's just non-negotiable. So the family has to be totally looped in, educated on medications, therapy schedules, all of it.
That coordination role. Yeah, that's
Yeah.
exactly why just calling them a doctor feels inadequate.
Mm.
Our sources detailed this huge variety of roles, blending the medical expertise with social guidance. Here's where it gets really interesting. Looking at all the different hats they wear, it's a holistic approach. Okay, so at the core, yes, they're the medical detective, right? Especially with little ones, infants, toddlers. They can't tell you what's wrong. The pediatrician has to pick up on subtle cues, figure out the right tests, diagnose the actual problem. It's almost like forensic medical work sometimes, finding the right fix.
And that detective work feeds right into being a preventative health advocate. It's not just shots. It's about screening early.
Yeah.
They're trained to spot those tiny markers for developmental delays, cognitive, physical, social way before they become obvious problems. And that allows for that critical early intervention.
Right. And then beyond the purely clinical stuff, they step into these support roles. They're a key educator. They're basically developmental coaches, giving parents, caregivers this roadmap of milestones. And it's not just height and weight, it's coaching on sleep, nutrition, healthy boundaries, you name it.
And, when a family gets difficult news, a tough diagnosis, or a serious illness, the pediatrician often finds themselves acting as a counselor. Offering comfort, sure, but also practical guidance. It's such a high-stress time for parents. And the doctor being able to clearly explain the path forward, that's massive for reducing family anxiety.
Which kind of takes us outside the exam room itself, because the research also shows pediatricians getting involved in the wider community. They act as community health advocates.
Yeah, this role is more about improving the health of the whole population they serve. So they might back public health initiatives, maybe advocate for better school lunches, or support local policies for safer playgrounds, cleaner air, basically translating policy into real health benefits for the kids in that community. And tied into that bigger picture, they're often a fierce advocate for children's rights. They have this legal and ethical commitment to child safety, ensuring their overall health. They act as a vital check against neglect or harm, always making sure the child's well-being comes first.
And obviously, to juggle all of that effectively, they have to be a crucial team player. Modern pediatric care is complex. It means constant teamwork, not just with hospital specialists, but often coordinating with school nurses, psychologists, social workers too. It's a network. Okay, let's focus on that family relationship. The sources show this partnership starts incredibly early, sometimes even during the prenatal phase.
It's actually brilliant when you think about it. By connecting early, pediatricians can offer insights on childbirth, give advice on preparing for the newborn. But maybe more importantly, it helps the parents feel comfortable, informed, before the chaos of a newborn arrives. It just smooths the path for those crucial early decisions, like choosing the right tests and sticking to the checkup schedule. And the reports we looked at really emphasize this isn't just about dumping information. It's about building real trust, involving parents, explaining things in ways they understand. That strong collaboration lets them create truly personalized treatment plans, including suggesting lifestyle changes that, the whole family gets involved in.
Okay, so if we connect that idea, that deep family partnership, to the bigger picture, the pediatrician's role in handling behavioral and emotional issues, that directly impacts the whole family's mental health, doesn't it? This feels like a significant shift from maybe a few decades ago. Pediatricians now seem much more attuned, better equipped to spot emotional or psychological challenges. Things like persistent anxiety, major sleep issues, aggression maybe, things children might face.
And spotting that early is just vital. They become this crucial first point of contact for mental health support, offering referrals, connecting families to specialized care. Plus, they counsel parents on practical things, how to create a supportive home environment, the real benefits of regular physical activity for mental stability. And this proactive approach, intervening early, it's absolutely critical. It prevents these issues from becoming deeply embedded, complex mental health problems down the road. The data really backs that up. Early help saves years of struggle.
And they also act as that key resource connection, right? When a family needs support that's maybe beyond the clinic walls, specialized tutoring, family counseling, the pediatrician is often the one who knows where to turn. They provide those referrals to the right community resources, addressing the family's needs more broadly, which just lifts everyone up. Okay, so we've covered a huge amount about what they do now, but the field itself is changing so fast with technology, medical advances. So what does all this mean for the future of pediatric care?
Well, it means we're seeing breakthroughs that are really shifting the delivery model itself. Take telemedicine. It's way more than just phone calls now. It uses high-res digital tools, allowing pediatricians to, quite conveniently, diagnose and even treat kids remotely. They can look at a weird rash, assess a minor injury with pretty impressive clarity all through a screen.
And you can see how for families in rural areas or those far from specialists, that's just a massive win. Telemedicine makes sure that monitoring, getting quick professional feedback, it's always accessible, which must be especially helpful for managing those chronic conditions we talked about.
Exactly. And then look at the medical advancements themselves. We're stepping into territory that honestly felt like science fiction not long ago. Breakthroughs like gene therapy and immunotherapy, these are becoming real, effective options for diseases that used to be untreatable, sometimes terminal. I mean, think about rewriting a child's immune system code to fight cancer, or correcting a genetic fault causing a metabolic disorder. It's incredible stuff.
Truly game-changing. But the sources also highlighted how this advanced medicine is becoming super individualized.
It is. That's where precision medicine comes in. This whole concept is booming. It's about personalizing treatment plans right down to the molecular level. So instead of just a standard dose based on weight, we can now look at the patient's specific genetic makeup.
And why is that so critical in pediatrics?
Because it potentially cuts out years of difficult trial and error. If a kid needs a specific drug, their genes might tell the doctor exactly the right dose first time around. Maximize effectiveness, minimize side effects. It just reduces toxicity, boosts the chance of success, and gets them better faster.
And finally, technology is also making inroads into mental health access, which is so desperately needed.
Oh, absolutely. The research specifically points to the value of teletherapy and these increasingly sophisticated digital mental health apps. For a child, say, struggling with social anxiety who finds going to an office really hard, virtual reality therapy could offer a safe, controlled, even engaging way to tackle those challenges. These kinds of innovations, they really promise to streamline care and significantly boost the long-term well-being of kids and their families.
Wow, what an incredible range of dedication we've really covered today, from, the lab bench doing research right through to the counseling chair in the clinic. Pediatricians today, they combine this deep, cutting-edge medical knowledge with, it seems, a real empathy and compassion, tailoring everything to the individual child, their family situation, their beliefs. That vital job of protecting a child's well-being, you just can't overstate its importance. Acknowledging this huge commitment helps ensure every child gets the best possible shot at a healthy, thriving life.
Absolutely. So for you, our listener, taking all this in, if you're looking to connect with professionals who really do treat your little ones like part of the family, well, we have a very clear next step for you. For more helpful tips, loads of detailed info on pediatric services, or maybe to check out resources like the Omega Promise blog, you really need to visit omegapediatrics.com. Seriously, check it out. That's omegapediatrics.com.
And hey, if this deep dive was useful for you today, please do us a quick favor. Like this video, subscribe to the channel for more insights like this, and please share this knowledge with anyone you think might benefit.
We really look forward to connecting with you again soon.
Goodbye.